Imagine your spine slowly but surely turning to bone. I mean, the ligaments that are supposed to be flexible just calcify, fusing together until you have this solid, rigid column. It sounds like something out of science fiction, right? But it's not. It's a real and surprisingly common condition called diffuse idiopathic skeletal hyperostosis, or for short, DISH.
Okay, let's just jump right in. What you're looking at here, these are actual scans of a spine with dish. You see that really thick, flowing white line running down the front of the vertebrae? Yeah, that's all new bone, growing where it absolutely shouldn't be. And the reason people call it dripping candle wax is because of that continuous, almost liquid-like look it has. It's a pretty wild visual for a condition that, believe it or not, a lot of people don't even know they have. So what is dish exactly? Well, the name itself kind of gives you some clues. Diffuse means it's widespread. Idiopathic is the fancy medical term for we don't really know what causes it. And skeletal hyperostosis just means excessive bone growth. So put it all together, and you have a systemic problem where the body's instructions to build bone just go into overdrive. It mostly happens along the spine, but it can pop up in other places where tendons and ligaments attach too.
That whole candle wax thing is a really striking image, for sure. But the real problem isn't just how dish looks on an x-ray. The real problem is that this is an incredibly common condition, and it's often hiding in plain sight.
Just look at this number, 44%. According to some research, that could be the prevalence of DISH in men over the age of 80. Think about that. Even though it's the second most common type of arthritis right after osteoarthritis, it gets missed all the time, even by doctors, because the early symptoms can be super mild, or you might not have any at all. And if you dig into the numbers, you start to see two really clear trends. First, the risk just skyrockets as we get older, for everybody. It's definitely a condition of aging. And second, it's about twice as common in men as it is in women. This pattern right here gives us our first major clues about who's most at risk. And this is exactly why it's so much more than just a weird thing on an x-ray. Some people might not have any symptoms, but for a lot of folks, it can seriously impact their quality of life. We're talking chronic pain and stiffness, obviously, but that extra bone growth can also cause some really serious issues, like making it hard to swallow or even blocking your airway if it's growing in your neck. And here's the kicker. That fused spine becomes brittle. It dramatically increases the risk of a fracture from even a minor fall. So, okay, it's common and it can be pretty serious. But what on earth causes it? To figure that out, we have to kind of play detective and follow the clues. And we're going to start with the body's internal environment. This chart does a great job of showing just how complex the picture really is. There's no single smoking gun here. DISH is what we call multifactorial. You've got things like your genes, your age, and being male that play a part. But then you throw in metabolic syndrome, inflammation, maybe even things related to your blood vessels. It's like this complicated web of factors that all come together to create the perfect storm for this unwanted bone growth. Let's zoom in on one of the strongest clues we have, metabolic health. The link here is undeniable. Just look at these numbers. In severely obese patients who are 50 or younger, the prevalence of DISH can shoot up to 18%. And for people with type 2 diabetes, it's hanging around 13%. It really seems like these conditions create this permissive environment inside the body, where things like high insulin levels might be encouraging all this extra bone building activity. And here's where our whole understanding has taken a huge leap forward. For decades, scientists thought DISH was just a degenerative thing, not inflammatory. But as this quote shows, that idea is changing. Researchers now think that low-grade chronic inflammation is a major player, especially early on. This isn't just bone passively growing. There's evidence that it's an active process of bone getting broken down and rebuilt, all driven by some underlying inflammation. We've looked at the body's environment. But what about the body's actual blueprint? It's time to follow the clues from our metabolism right into our very own genetic code. So here's the big question. Beyond our age and our metabolism, is there a genetic component? Is this condition something that can actually be passed down, literally written into our DNA? And the evidence is pointing to a pretty strong yes. Studies have found DISH running in families, sometimes in a pattern called autosomal dominant inheritance. That is a powerful genetic link. To put it simply, it could mean that if one of your parents has it, you might have as high as a 50-50 chance of inheriting the genetic risk factors yourself. And now, thanks to modern genetics, we're starting to actually pinpoint the specific genes involved. This table shows just a few of the main suspects. Think of it like this. COL6A1 provides the scaffolding for the bone. ENPP1 is like the brake on bone formation. A mutation there means the brake is weak. And then you have genes like ACVR1, which are part of a signaling pathway that can get stuck on, just constantly telling the body, build more bone, build more bone. Okay, so we've got our clues, the environmental ones and the genetic ones. Now let's connect the dots and look at the actual mechanism. The biological pathways that turn all those risk factors into actual unwanted bone. At the very heart of this whole process are these incredible cells called mesenchymal stem cells, or MSCs. You can think of them as the body's raw building material. They're amazing because they can become bone or cartilage or other tissues. In DISH, it seems like these super important builder cells are just being given the completely wrong set of instructions.
And this slide maps out perfectly how that signal turns into unwanted bone. It all starts with a trigger, that powerful combination of genetic risks and metabolic factors we've been talking about. That trigger flips a switch, turning on these key molecular signaling pathways, like Wnt or BMP. Those pathways then send the wrong orders to those stem cells, basically yelling at them, turn into bone-building cells now. And the end result? Abnormal ossification, turning our flexible ligaments into rigid bone.
Understanding the mechanism is just a massive step forward, which brings us to the final and honestly the most hopeful part of our story today. Where do we go from here? What does the future actually hold for fighting DISH? Well, the challenges right now are pretty significant, let's be honest. There's no single way to diagnose it, so early cases get missed. And this is the big one. There are 0 therapies that can actually stop or reverse the bone growth. Treatment today is all about managing symptoms. And for a lot of those risk genes we found, we still don't know exactly what they do. But the research gives us a really clear path forward. The immediate goal is to create standardized diagnostic rules so we can catch DISH way earlier. In the near future, the big push will be on functional studies, basically figuring out what all those risk genes are actually doing. And the ultimate goal? To use all that knowledge to develop targeted drugs that can hit those specific pathways like Wnt or BMP and create the very first therapy that could actually change the course of the disease. Which leaves us with this one kind of wild, forward-looking question. As we get better and better at understanding these incredibly complex genetic and molecular pathways, you have to wonder, if DISH is really just the result of the body following a faulty set of instructions for building bone, could we one day learn how to rewrite them? It's a fascinating thought for the future of medicine.